Hi, I'm Dr. Lewis, and I'm here to answer some questions for you. And as always, this is for information purposes only. This is not intended to be medical advice. If you need medical advice for you or a family member, please contact your healthcare provider. The question that I've been asked is, what about these new COVID booster shots? FDA and CDC have recently authorized new COVID booster shots for this fall. And it seems like that it's a pretty good idea for those of us who qualify. As you know, COVID's been circulating for a while and it's been changing, it's been mutating. So the booster shots that we have had available to us are not quite as effective as they once were. The new vaccine, the new booster shot, has not only protection against old COVID, the COVID that's been circulating in the past, but also provides protection against the new versions that are circulating now, Omicron and its variants. So this should provide better protection against the current viruses. So what does this mean for you? Should you get this new vaccine? Well, if you're a teen or an adult and it's been at least 2 months since your last COVID shot, you're eligible. Or if it's been 3 months since you've had a COVID infection, you are eligible. Or if you have health conditions that put you in the high-risk category, you should consider getting this new booster shot. You might have noticed that I said that if it's been 3 months since you last had COVID, that you were last sick with COVID, you can get vaccinated. I get asked a lot, if I already had COVID, why do I need a booster shot? Well, the reality is that yes, being sick with COVID does give you some immunity, but that immunity tends to trail off after about 3 to 6 months. So that's why the CDC is recommending that if you've been sick and it's been at least 3 months since your last illness with COVID, then you should consider getting one of these new booster shots. Now let's focus on flu season, which is coming up as well. This year, public health experts are predicting a heavier than normal flu season. And how do they know that it's going to be heavier than normal? Well, those countries in the southern hemisphere have their flu season just before we do. And countries like Australia have been having a heavier than normal flu season, which typically means that we will also have a heavier than normal flu season. The good news is that the flu shots that are available this year are pretty well matched to the strains of flu that are circulating. So the flu shots this fall should be pretty effective protection against getting the flu and having severe disease. So if you're hesitant about getting the flu shot this year, here are 3 good reasons to consider. First, it should be pretty good because it's well matched against the strains that are circulating at keeping you from getting sick this year. And if you do happen to get sick from the flu, you have a breakthrough infection, it should provide good protection against severe disease and help shorten the time that you're sick. And then also, you want to be productive and you want to be able to spend time with your family. So getting the flu shot can give you a better chance at having an illness-free fall and winter. So on your fall checklist, you should have 2 items. Get a flu shot and get the new COVID booster. The good thing is you can get both of them on the same day at the same doctor's office visit or same pharmacy visit. All you need to do is schedule for both of them, and it is possible to get them both. It's safe. Well, this has been Dr. Lewis, and thank you for your time. And again, if you have any specific questions related to your health or the health of a family member, please contact your healthcare provider.